Chances are you or somebody you know has knee pain. Is it you? Maybe someone you know? Either way, by watching this video, you'll be able to help yourself or help someone you care about. Are you ready to get started? Today I have with me Dr. Earl. How are you?
Doing great. Thanks for having me.
Good, good. After working in emergency medicine for 16 years as a boarded emergency physician, he then went into regenerative medicine for 12 years, which allowed him to speak nationally on the regenerative medicine end. But for today's video, we are going to be learning about bone injuries. And to start us off, what is a bone injury, Dr. Earl?
Yeah, bone injuries come in a lot of different forms. Obviously, the most common and the one that everyone recognizes right away is a bone fracture. There are several types of fractures. There's an incomplete fracture. There's a green stick fracture. Those typically only happen in the very young. Their bones are very pliable and tend to bend quite a bit before they break. And then as we get older and the calcium builds in, it becomes a little more solid, if you will, then we get complete fractures. And then you can have different types of fractures from that standpoint: compound fractures, simple fractures. You can have bones that shatter and are in multiple pieces. So there's a lot that can happen as far as bones are concerned just from a fracture. Then you can have chip injuries where a chip is pulled off. You can have stress fractures. Again, just a lot of different injuries that can happen with the bones, bone bruising, what have you. And the big thing to keep in mind is it is a living tissue, and so it repairs. Breaks down the fractured parts, repairs, and puts itself back together. The body's amazing. It's a miracle.
That's amazing. Good thing to know in regards to the bone injuries. But with that being said, why would that be a problem?
Well, bones provide our bodies with strength and with structure. The muscles actually use the bones as leverage points to allow us to move. And so if you have a bone that's fractured, bruised, not working correctly, or in general pain, the reality is any kind of movement can cause significant discomfort, and or downright pain, or with complete fractures, complete dysfunction. And so certainly understanding that those bone injuries can be a big deal, can guide you in when you want to make sure and get care.
Of course. And when you're seeking care, what kind of options do we have for that?
Well, if you have a complete fracture, you want to make sure and get diagnosed either with an emergency department or with your regular doctor. There are ways that they can diagnose fractures without x-rays, but by far, x-rays are the most consistent way to diagnose fractures. It's a simple x-ray that imaging, you go in and they take a picture and then take a look at it. It's often fun to then see your own x-ray and say, yeah, there's the problem. But the x-ray can show us some other things, and one of the other common issues that occurs with a bone fracture is something called a second fracture or a hidden fracture. And that's why sometimes it's important to get a complete evaluation by a medical doctor. Sometimes bones can just be bruised. Often those won't show up on a plain x-ray. They need an MRI. You can have what's called an ischemic injury. That's where a portion of blood supply is cut off to a piece of bone. That typically only shows up on an MRI. And so there's a lot of things, but imaging usually is required to really give a complete and thorough look to a bone fracture or a bone injury.
Wow, definitely sounds a little painful depending on the injury. But with that being said, what can Denali do to help, and how does it compare to those other treatments?
Once you've had an appropriate diagnosis, sometimes with a fracture, it's then the opportunity to see an orthopedic surgeon and get things put back together, casted, surgery, those type of things. Those can be very critical. A lot of the other injuries, and bone fractures as well, will heal faster, dramatically so, sometimes even in half the time, if they're giving an appropriate dosage of nutrients and blood supply and oxygen. And that's what we do. We are able to go in and provide nutrients and oxygen that surround the tissue and really increase the healing that the body does. The body, again, miraculous. It will break things down, then put it all back together, and hopefully within a matter of weeks to months, you're back to running pretty much to normal. Occasionally we have some patients that because of scar tissue or other issues that the bone didn't quite heal correctly, they have residual pain. And again, under those circumstances, the treatments at Denali can go in and help reset that nerve tissue so that the pain is abated.
Wow. Well, it sounds like that's a great option. Who would qualify for such treatment that Denali can provide?
Yeah, so again, some of the things, if you have a complete fracture, make sure you get diagnosed, make sure it gets stabilized. That means splinting, casting, and sometimes surgery, pinning, those type of things. But after that, usually within about 3 to 4 weeks, if you want to accelerate healing significantly, then you would qualify for getting treatment at Denali. If you have things like bone bruising or ischemic injuries or other type of injuries, we can get started on a much more rapid basis at Denali.
That makes sense. So who would be considered for treatment once they're qualified? Who would be looking into that?
Yeah, as mentioned, any age group can come in. We usually like to wait until the bone has at least had a little bit of time to start regeneration. Mm-hmm. And anytime you have a surgical procedure, we need to wait a prescribed amount of time as well. We don't want to make things worse, but we certainly can help make things better faster. But any age group, any demographic can actually help because we're using foundational treatments. Nutrients, oxygen, things that the body really thrives on to recover and do well.
That sounds amazing. So again, where would we go to find out if we pre-qualify? DenaliMed.com, correct?
Yeah, the website is DenaliMed.com. On there you'll find some additional information about what we do and why, and then you'll find phone numbers if you have some additional questions. Please feel free to give us a call.
Amazing. So again, bone seems like quite the serious injury. So if it's something that someone is looking outside of surgery, Denali would definitely be the place to go, correct?
Outside of surgery, if that's the consideration, and or after things have been stabilized, we can make things heal faster. And when I say we just stimulate the body's amazing healing process to go faster and better.
That's amazing. Well, thank you for joining us today on our video for bone injuries. I hope you learned a lot. I know I did. But again, please feel free to visit us at DenaliMed.com.